Hi, everybody. I'm Dr. Emma here at Salvatore Dental. We get a lot of questions about tooth decay here, so I'm going to answer some of the most common questions that we get on this topic to give you a better understanding. So tooth decay is the damage or breakdown of enamel, which is the outer layer of the tooth structure. And tooth decay is also known as a cavity, which starts in the enamel, or the outer layer of the tooth, and it progresses into the inner layer of the tooth. Essentially, this breakdown in tooth structure creates a hole in the tooth. So it's interesting because in order for tooth decay to begin, we need two components. We need sugar and we need bacteria. See, what happens is bacteria in the mouth feed off of sugar and starches from the food that we eat, and the bacteria love sugar. When we have an accumulation of bacteria in our mouth, they will eat the sugar and produce an acid. This acid dissolves the tooth structure and takes away all of the important minerals from the enamel. So when a cavity progresses, you may see a hole or you may feel a hole in the tooth. You may also see a discoloration or a darkness in one area of the tooth. This may be accompanied by pain or sensitivity. But in the early stages of cavity formation, you may have no signs or symptoms at all. You may find out at your dental visit that you have decay during your checkup. Radiographs, also known as x-rays, are taken routinely in order to examine between the teeth. Sometimes the dentist will be able to see a cavity during the examination, but many times cavities form right in between the teeth, and these cannot be seen simply by looking at the tooth. This is why x-rays are so important. So leaving tooth decay can have a really negative impact on your quality of life. You may have difficulty eating, difficulty speaking. You may notice a decrease in your confidence, especially if the cavities are visible. So tooth decay effects range from mild sensitivity to severe pain. Untreated decay, which weakens teeth, can create pus pockets surrounding the tooth and can allow bacteria to enter the bloodstream. If left untreated, it can lead to a systemic infection. So the answer is not very simple. It depends. If the cavity is small enough and only into the enamel or the outer layer of the tooth, then we have a chance to remineralize that tooth, that portion of the tooth that is demineralized. For scenarios like this, I would recommend regular treatments of fluoride and impeccable home care. Home care must be flawless in order to stop the cavity from getting any deeper. However, if the cavity is already past the enamel, then treatment by a dentist must be done in order to fully remove it. At this point, the damage to the tooth is irreversible, so the cavity needs to be removed. So if the cavity is small enough, we can repair the tooth with a filling. The cavity is removed from the tooth by a dentist, and a white composite material is placed in the tooth to fill in where the cavity was sitting. Now, if the cavity is large enough or the integrity of the tooth is compromised, the dentist may place a crown over top of the tooth. In this scenario, the cavity will be removed and the tooth will be shaped in a way, a very strong cap or crown to be bonded and cemented onto the tooth. A crown will give better support to the weakened tooth. So if the cavity is very deep and it's approaching the nerve of the tooth, then a root canal may be required. In this process, the nerve of the tooth is removed and the tooth is then restored, likely with a crown. There are circumstances in which the decay is too deep and the tooth is too compromised. In this situation, an extraction of the tooth would be necessary. So the best way to stop tooth decay from spreading is to treat it when it is detected. As soon as a cavity is detected, recommended treatment should be done as soon as possible to prevent the decay from getting any bigger or even causing pain. The longer you wait, the potential for the cavity to get bigger and spread will increase. So preventative treatment is the most important way to stay on top of your dental health. Regular visits to your dentist for cleanings and checkups, along with daily brushing and flossing, will set you up for optimal oral health. So I hope I've answered some of your questions about tooth decay and oral health. If you have any questions or if you'd like to schedule an appointment with us, you can give us a call at 518-899-6068. Thank you so much.